Ghana Means Business, brought to you by Goil. Goil, good energy.
Ghana Means Business. Your story, our message.
Welcome to Ghana Means Business, your apolitical, factual, unbiased, and most well-rehearsed television program that presents the business, investment, and financial issues in Ghana today. Coronavirus will not only have a major health crisis, but will have a major economic impact in terms of our economy. We are honored to have with us today the first ever Chief Executive Officer of the University of Ghana Medical Center, Dr. Darius Kofi Osei, and Dr. Godfrey Chechi, who is the Senior Emergency Medical Specialist at the University of Ghana Medical Center, to discuss the steps, the resources, the equipment, the medications, the test kits, the recovery rates, and the major impact of the University of Ghana Medical Center in our quest, our fight, our determination to fight COVID-19.
Ghana Means Business. Your story, our message.
I must say this is an incredible masterpiece that you've created in Ghana. The UGMC Medical Center is indeed a state-of-the-art place to be. Well done.
Thank you, Nana.
Doctor, tell us about the UGMC. How is it set up? What is your mission? What are your objectives? What kind of infrastructure do you have? How many departments, or in medical terms, what are the types of services that you provide in its current state?
Well, the vision is to be a distinguished, for world-class patient care, research and training. That is the vision.
Is it affiliated with the University of Ghana Medical School?
Yeah, the University of Ghana and the government of Ghana are shareholders.
Okay.
Yeah, that is. And it is committed really in providing a premium healthcare by highly motivated, skilled, through innovations in integration. That is the quaternary care.
What is quaternary care?
Quaternary is above tertiary. Now, if you recall, we used to have internalists, that is a physician specialist who is trained to take care. Now we have doctors in charge of maybe diabetics, that is endocrine. We have doctors in charge of gastro. So we have gone beyond the generic into narrow specialties, and that is what quaternary means. Okay. That is subspecialties. Okay. Right.
So in terms of infrastructure, what do you have here?
Infrastructure, you can see that the buildings here, we're supposed to have 8 buildings. Building 1 is where we have the diagnostics. That is, we have the diagnostics, means the laboratory, the photo imaging section. We have the theaters. We have the ICU, that is an intensive care unit. We have the CSSD, that is the sterilization and other places. That's the building 1. Okay. Building 2 is the mother, the women and children. That is building 2. Okay. Yeah, and then building 3, where we have the administration block and then the outpatient department on the ground floor. And then we have the building 6, that is where we're sitting now. Okay. This is the training and simulation center.
It's a masterpiece.
Yeah, it is. It is. And then we have building 5, that is the trust towers, where we have the medical and surgical block to be completed in the second phase. And then we have the building 7, that is a housing unit for the various persons who may come for training here. This training school is open to the whole country. So for instance, if Tamale Teaching Hospital wants to come and do training simulation, you can have a place for the students to stay overnight, or great. As long as they are here. Building 8 is staff accommodation. for core staffs who will be working, and it's in phase 2.
Okay.
And that one is not yet done. We're expecting to be handed over in June 2021.
Doctor, the issue of the day, the scourge of COVID-19. Now, the government of Ghana has designated the University of Ghana Medical Center as a COVID-19 quarantine center. How prepared, how equipped, how resourced, well-resourced are you to undertake this national responsibility?
Yeah. I think when we were mentioned to be used for treatment for COVID-19 patients, it was something we needed to embrace because it's all about healthcare. And what do you do? First of all, you have to encourage your staff because most people didn't embrace it fully. And so leadership was very important here. I needed to exhibit this leadership strength by encouraging my staff, inviting personnel from Noguchi to train our staff here, and then making sure that training in terms of safety, how to don the PPEs, how to doff them, and how to... So we did this long before we started getting patients. We also visited the Ghana East. That is the place that had been also designated for treatment of COVID-19 patients. They had started earlier. So the doctors and the nurses all visited the place just to give them some confidence that after all, some people are already doing it, so we can do it. And then again, we observe the patient experience and then the processes that staff had to go through. Just when we had finished this preparation and demarcated our areas into high risk and low risk areas, we were called that we're getting 26 patients. Wow. That is those who had tested positive after they were discharged from the hotels. Okay. You recall that there was a compulsory quarantine of about 1,030 persons who came from abroad.
That is true.
And then those who tested negative in the beginning were tested again, and then 26 of them were positive. So we got our first patients, that's the 26 patients. And then we also got some few in the ICU. Okay. And really, because we were prepared, we managed them and then discharged the first 18 after 9 days, and then just 2 days ago, the rest. But we are getting some more. And
that's new cases.
Yeah, new cases are coming from the National Task Force. They bring them to us. So as I speak to you, we have 15 patients who we are managing. And so far, all our frontline staffs have been tested, and everybody is negative, which means we really prepared ourselves and adhering strictly to the safety measures and so I'm sure that it's going to become one of the normal things that we do. Mm-hmm. We also really never thought that, look, pregnant women can also have COVID.
Very important issue.
No, so we got...
And so you've been receiving pregnant
women? Yeah, we got one pregnant woman who had COVID positive. So we had to prepare a labor ward and a theater for this woman. But it gave us that sense that, look, this is also a possibility. And so we must prepare ourselves that, look, pregnant women can also be part of the agenda. So as I speak to you, we have managed to get a labor ward and a theater to manage such patients. Again, I think UGMC, we got a letter from the Ministry of Foreign Affairs and then regional integration that it has been designated to take care of the diplomatic call. Oh, okay. So we've got visitors from the American embassy. We had the Japanese embassy visiting us. And just this morning, I think you saw the Germans are here. they are all interested, and then they are excited. They wanted to see how prepared we are, and they've been taken around where we will keep our patients and what other facilities that we have, and then even the logistics to manage them. And I think they are all very satisfied with our preparation.
Well done,
Right.
Doctor.
Thank you.
Doctor, the question would be, what does COVID-19, is there a correlation between that and foreign direct investments, our economy, the ability for us to bounce back? Where do you see the correlation? Is there a correlation between the
Definitely so. Definitely so. I think it has affected all areas, including care. We wanted to launch ourselves to the public somewhere around last month, and we started getting patients coming in until the lockdown. And then all of a sudden, we realized that we are not, even the pregnant women who were coming for antenatal clinics stopped coming. And so it tells you that everybody is scared and being careful. So things are not normal. And we are scared that we're going to have a lot of complications after May and June. And these complications are to do with those who are supposed to come for their normal reviews are not even coming. And then even the fear of the supply chain in terms of hospital consumables. I mean, what we are using now is the stocks that we have. How are we going to continue getting the supplies? Because most of the items we use are all imported items. So,
Doctor, on the technical side of COVID,
right.
What exactly is this coronavirus?
Right. On this question, I think I would not behave like I'm a master of all. Okay. I will ask that my technical person trained to educate the public about COVID will join us, and then you can ask him all the technical questions relating to COVID-19.
I'll be very grateful.
And he's in the person of Dr. Godfred Techi, who's been trained to educate the public about anything that you want to know about COVID-19.
I'll be most grateful.
Right.
Every now and again, Goil makes good things happen. This time, Goil has introduced Super XP Ron 95, a higher grade fuel loaded with additives and yet sold at the same price as normal fuel. Goil Super XP Ron 95 enhances engine performance like never before. It maintains the engine by keeping it clean from carbon deposits. Goil Super XP Ron 95 is designed to burn slowly and thus improves fuel economy, making you save money after several kilometers. Goil Super XP Ron 95 gives you a smooth driving experience, that is, less vibrations. Fill up with Goil Super XP Ron 95. Now there's no need to pay more for any higher grade fuel. Goil has that sorted. Goil, good energy.
Ghana means business. Your story, our message.
Dr. Godfred Jojo Techi, what a rare privilege to have you on our show.
The pleasure is mine.
Doctor, the scourge, the fear of coronavirus is unprecedented. So for a patient walking through your doors who has COVID-19, what are the typical actions, or what would you normally do when a patient walks in?
Okay, thank you for this question. When normally, since we're designated as a treatment center, we get calls. So we get a call from the national team or from any other private facility who has gone through the national. Then the call comes that we have a patient confirmed, as in they have done the test, and the test has come positive for COVID-19. So we prepare. So we put things in place, make sure our beds are ready, all the things we need per the type of patient that is coming. In terms of type, mean in terms of the severity of the illness. So we make appropriate preparation for the type or the condition state that the patient is coming with. So when the patient comes in, We review, receive, admit, start our treatment. We continue that every day.
Doctor, why is this virus so deadly? I mean, we've had everything. HIV, Ebola, SARS, MERS, all the things you've spoken about. What makes this particular virus so dangerous? What is it about it?
Okay. It's a new virus. And with all new microorganisms, the hit is hard. We don't have any immunity against it, okay? And the way it spreads, when you look at the way we live our lives, we are social animals. We interact, we touch each other, we hug, we shake hands. And if you study the way the organism spreads or the virus spreads, you say when someone coughs or sneezes, we all say, when someone sneezes, we say, bless you. So until this, when someone sneezes, we say, bless you. We don't move away. So because we didn't know all this, and we're still doing them, our way of life, our culture, actually aided the spread of the virus.
For lack of a better word, I want to play a game with you. Okay. And this game is based on either just a yes or no would even do, so that our cherished viewers, the majority of Ghanaians watching us, and the world will get to know what is a myth and what is the truth. Because due to the misinformation, there's a lot of confusion. The first question, doctor, is, does exposure to the sun or residing in regions that are very warm and hot prevent the coronavirus disease or COVID-19?
The first thing I'll say is that it's not true. Because we are in Ghana. We have a lot of sunshine.
So it is not true?
It's not true.
Second question, can one recover completely from the COVID-19?
Yes, you can recover, but you are not out of the woods. You must still maintain social distance.
Question number 3, doctor.
Okay. Yes.
Does holding your breath for 10 seconds or more without coughing or feeling any discomfort mean you are free from the COVID-19 or any other lung disease?
No.
Does drinking alcohol protect you against COVID-19?
No, sir.
Doctor, no, hold on. I've been drinking a lot of single malt whiskey lately. Are you saying that it hasn't provided any defense whatsoever?
My answer is still no, it will not protect you.
Does taking a hot bath prevent the coronavirus?
No.
Can the coronavirus be transmitted through mosquito bites from an infected person?
No.
Are hand dryers effective in killing the coronavirus?
No, please.
How about eating garlic? Does it prevent the coronavirus?
No.
Doctor, before you leave your house, is it mandatory? Is it a requirement for your own safety to wear a protective gear like what I have on?
Yes, now the recommendations for everybody to wear masks. Let me just give a little information about the masks. The reason why we advise for mass adoption of masks is that there is a group who are called asymptomatic, as in they don't have fever, cough, muscle ache, loss of smell or taste or diarrhea or sore throat. They are fine, but they may have the virus.
Everything is normal with
Everything is normal. They don't even know they have the virus.
And they are infecting others.
These people can cough, and if you at times when you talk, some saliva can come out. So if this cough or saliva falls on surfaces and anyone touches, it may be spreading. So if we are all wearing a mask, whatever someone has will stay with the person. Or even if all doesn't stay, what comes out is less. Then it becomes protective for everybody. So with the mask, if only few people are adhering to the mask, it's useless. But if everybody is wearing it, we are protecting ourselves. So if you are asymptomatic and your body can handle the virus, with time you get better. And others who don't need to get it, don't need to get it.
Back to my game, doctor.
Yes, sir.
Can traditional herbs cure coronavirus?
We don't have any data to support that, but it will be a very promising and good news for us as a country if we can find such herbal preparations that can do that. At the moment, there's no evidence to that.
Can we develop immunity against coronavirus?
Okay. Allow me to go a bit into the world of virology. When your body gets into contact with a virus, your body responds in two main ways. We have the non-specific innate response, where your body uses some of your immune cells, like, I don't know whether they worry me about this macrophage, but macrophages, neutrophils, the dendritic cells, they are part of the immune system, okay? They mount a non-specific response, okay? What it's supposed to do is that it's supposed to slow the progression of the virus, and at times may actually prevent you from having symptoms. That's the non-specific one. Then we have what we call cellular immunity, where your body produces antibodies, and the antibodies are supposed to neutralize the virus. Then there's also T cell production. The T cells target all cells in your body affected and destroys them. So if you put the antibodies and the T cell together, we say combined immunity or the cellular level, can actually clear the virus. But the issue here is this: some people have recovered from COVID-19, but then the amount of antibodies they have in their system is so low. They are those who are easily at risk of the next reinfection. But those who tend to have high amount of antibodies, when they take the right precautions, assuming they take the same precautions as those with low, the chances that they may not get the infection is low compared to those who have low. That's why I was.
So your answer is it depends on the individual immunity system.
That's why I was struggling to answer.
So
yes
it is.
Or no.
It is possible. It
yes.
It is yes.
It is.
Yes, it depends on the person's immunity.
Thank you.
Okay. Now, there's something that the University of Ghana Medical Center did recently, which is ingenious and phenomenal. You launched COVID Connect. What is COVID Connect?
Okay. COVID Connect is a service. We make use of an app. The app is called Lusky Vitals. You can download it from Google Play Store or...
Is it this the Lucy Vitals?
Yes, Lucy Vitals.
Okay.
And you can download it from your phone. So your store, if you use an Android, that's Google Play Store. If you use an iPhone, that's the iOS store. Okay. You can also download it from University of Ghana Medical Center website, which is UGMedicalcenter.org. For emphasis, I want to just repeat. Our website is UGMedicalcenter.org. So what is this service? So the Lusky app shows the various symptoms that we now know. Can give you, when you put them together, can point to whether you probably have coronavirus disease or not. So when you download, you go on the app, you take the symptoms based on how severe or mild. There's some categorization on the app. You take. When you take and you finish and you submit, it comes to dedicated team of doctors at their center here in UGMC. And based on the symptoms that you have, the symptom profile, and the categorization we get for you, we follow you up. So if we do a lot of clinical psychology counseling, we can also bring you here and do a test for you if we think you meet the criteria for testing. And we can also arrange to even bring you here and admit you.
Okay.
So it's like we actually bring in a service of care for COVID-19
to your home.
To your home, to your phone.
The comforts of your
home, yes.
Through your phone.
Through your phone.
Amazing.
So that's what COVID Connect is all about.
Congratulations. Doctor,
yes, sir.
What is your message to Ghanaians? What must we as a people learn from this?
We need a lot of facilities, okay? But the facility is one thing, okay? We need to get the right people trained to deliver the service.
Absolutely.
So that's the next one. And the third one will be the people should be motivated. So we should make sure we put things in place that when someone is working, all he has to think about is the work and not to think of other things. So people should have comprehensive health insurance so that when they are working, they are not thinking about if something should happen to me, though they will take the precautions. We should have continued training of staff around the year.
Customer service especially.
Yes.
Healthcare.
Exactly. So then also, I'm happy we are producing most of our things here. So that most of the things we need to work with in the hospital, if they are locally made, is better. We make sure year-round we have enough supply. It will improve the local economy.
Especially the consumables.
Exactly. It will improve the local economy, our drugs and all that is good for us, okay? So going forward, for the pandemic, now we've been hit with COVID-19. A lot of people who didn't used to wash their hands are washing their hands. People are now being careful when they are coughing and stuff like that. So my prayer is that going forward, these are going to be part of what we call our new culture. People are becoming more innovative. We've all been following the news. People coming up with nice ways of putting up simple things you can use to wash your hands without touching and all that, which for me, it really gives a lot of credence to what we all see. Necessity is a matter of invention, okay? So I'm very happy. And I'm very happy the way Ghanaians have accepted to adhere to the safety and preventive measures. I know a few people may not be taking it serious. So I'm appealing to them. They should take the preventive and safety measures very serious. Because when we reduce the rate of infection, it means we are going to reduce the workload on doctors and nurses and another category of staff involved in the care of COVID-19. And when that happens, it means once we are not overwhelmed, we will not make mistakes that will expose us to. So my life is in your hands. Protect yourself so that I'll be protected. Thank you.
Thank you. And well said, Doctor.